In this video, we will discuss about cataract surgery from chapter lens. We will discuss about extracapsular cataract extraction and phacoemulsification and the differences between them. First, we will discuss about their principles. In ECCE, extracapsular cataract extraction, lens nucleus and cortex removed, leaving the capsular bag behind, and same principle is used in phacoemulsification also. Next, dilatation of pupil. It is required in both ECCE and phacoemulsification. Magnification is required in both ECCE and phacoemulsification. Microscope is used in both the surgeries. Incision. Medium incision is done in extracapsular cataract extraction ECCE of 120 degree. The length of the incision is 7 to 8 millimeter and it is done from 10 o'clock. And in phacoemulsification, small incision is done at an angle 30 degree with length of incision is 3.2 to 3.5 millimeter. Now discussing about techniques of lens removal. In capsulotomy in ECCE, it is done by can opener technique or rhexis, and in phacoemulsification, it is done by rhexis. Nucleus delivery is done by manual sliding in ECCE, and phacoemulsification is done in phacoemulsification. The process is also the name. And in cortex removal, irrigation, aspiration can be manual or automated in ECCE, and phacoemulsification, it is cortex is removed by irrigation, aspiration, and it is automated. It is not done manually. Intraocular lens is put in the bag and implanted into the posterior chamber. In both the surgeries, same technique is used for implantation of lens. Sutures. In ECCE, sutures are required and it is continuous or interrupted. And in phacoemulsification, suture is not required. Now we discuss about method of cataract extraction. In ECCE, central part of anterior capsule is removed along with nucleus and cortex of lens, and posterior peripheral part of anterior capsule is left inside. And in phacoemulsification, it is basically an ECC with an instrument called phacoemulsifier which emulsifies lens nucleus and cortical matter by ultrasound vibration. Then it is removed by simultaneous irrigation and aspiration. Titanium probe is inserted into the lens capsule and lens nucleus is emulsified by the titanium tip, which vibrates about 40,000 times per second. Indications for ECCE. It should be performed in patients less than 40 years of age, high myopia with degenerative fluid loss, and it is procedure of choice over ICCE. Phacoemulsification. Indication is same that of ECCE. It is overall method of choice. Contraindication of ECCE are markedly subluxated lens or dislocation of lens. And in phacoemulsification, it is same as ECCE. It should also be not done in subluxated lens or dislocated lens. Advantages of ECCE are posterior chamber intraocular lens can be implanted, and there is less chances of endophthalmitis, vitreous traction and loss, leading to less chances of cystoid macular edema, tractional retinal detachment, pupillary block, vitreous touch syndrome and vitreous wick syndrome. And in phacoemulsification, advantages are same as ECCE. These advantages already discussed, and plus some other advantages are like small incision sutureless cataract surgery and rapid wound healing with shorter convalescence is seen in phacoemulsification, and early stabilization of refraction with minimal or no refraction. All advantages of ICCE are disadvantages of ECCE. Example: possibility of after cataract lens particle induced glaucoma and uveitis. It is not seen in ICCE, but it can be seen in ECCE. And these are the disadvantages of ECCE, as these three features can be seen in ECCE. And in phacoemulsification, disadvantages are same as ECCE, plus some other disadvantages are like it is costly and most difficult to perform. Please like the video and subscribe to my channel.